welcome back to my channel. I'm Gia. I'm your friendly nurse practitioner here to support you through your first year as a nurse practitioner. So today I am going to talk to you about how to handle challenging or difficult patients. So the other day, my medical assistant told me or warned me that my next patient's gonna be difficult. And she said that, she was agitated by my questions. And so I prepared, then I entered the room and greeted this patient with, I always do, like I always do. So I always say, "Hi, my name is Gia. I'm the nurse practitioner is going to be helping you today. How are you today?" And so I greeted this patient with warmth and welcoming attitude. Like I said, I always do this with all my patients. And my visit ended nicely. But I did sense that this patient was, not following her medications. She wasn't always taking the medications for her blood pressure, and she always was not very receptive to the recommendation, and she continued to smoke. But I proceeded my visit, or I handled my visit in a way that I always do. I always did my best with asking her questions, understanding her concerns, making my recommendations, and just doing the best that I can during that visit. Now, will she listen to me, or will she listen to my recommendation? Did I even make a difference? Maybe, maybe not. But I learned that I cannot always control the reactions or the actions of my patients, right? When I think and feel I did the right thing for my patient, I let go and let God handle the rest. But I was not always like this calm and collected when it comes to dealing with challenging patients. When I first started, I used to dread seeing patients that we perceive as difficult, challenging, demanding, unrealistic. And there were moments when I felt defeated and low after encounters with this type of patients. I remember one particular patient who came in with multiple complaints and who also spent majority of the time of the visit blaming and complaining about healthcare system and providers in general. So as the time ticked away, I felt the pressure of the clock, and I interrupted her to ask her the questions I needed, to be able to help her with her medical needs. And she immediately became defensive, and she accused me of, seeing her as a number and not as a person. And I remember she said, "You are just like the rest of them, and you see me as a number and not as a person." In that moment, my ego was bruised and I reacted defensively. Why? Because I feel I am a good provider and I don't see my patients just as numbers, and I wanted to let her know that she was wrong. But looking back, I realized that I failed to acknowledge her concerns because I was so worried about my time and my own ego. Instead of focusing on how I could help her, I was so focused on my own need to end the visit on time and also to protect my pride, sad to say. And it was a big mistake and it didn't end well. Approaching patients like this isn't the best way to go about it. After all, our patients come to us seeking help, right? So it's important for us to find a way to assist them using our own judgment to gently interrupt them when needed. My supervising physician, he is an expert at this. He always knows how to handle this type of situations. And this is his statement. I always say, I hate to cut you short, but I really need to ask you some specific questions so I can better help you with your needs today. And he does this all throughout the visit, because some patients can get a little more chattier, and some of them will share more than what we need to hear. And this statement really helped me with this type of patients too. And what I also come to realize is that sometimes allowing our patients to vent, to express their concerns for the first 3 to 5 minutes can actually be very therapeutic for them. And simply acknowledging their concerns can go a long way in building trust and showing that we're here to help. And so you might think that, oh, I don't have time for this. I have so many patients to see. I need to cut to the chase and get to the bottom of why they need help. But let me ask you a question though. Would you trust someone who couldn't even spare a few minutes to listen to you? I doubt it. You see, when patients express anger, frustration, or anxiety, it's not about us. Most often, they're going through difficult situations, difficult times. Maybe they're worried about their health, or maybe they have health concerns, but they also are dealing with a loved ones who just got recently diagnosed with cancer or any type of terminal illness, or they're facing some challenges at work, or they're just facing challenges they feel they have no control of. But they're coming to you for help. And I want to point out that this is not the time to judge their ability to handle their problems. You may perceive their situations as something you can easily handle, but your patients may not perceive it that way. Again, remember, your patients come to you for help, and not just for your medical expertise, but maybe to your expertise to handle difficult situations, and also for your compassion. Understanding their struggles has taught me to approach them with more love and compassion. And I've learned to see beyond their tough exterior, the anger, the anxiety, the frustration, the sadness, and the worries or any uncertainty they may be hiding. So when they express their frustrations verbally, I now respond with grace and gently reminding them to communicate respectfully. It's not always easy. I've had patients, I had a few patients lashed out at me, and it never feels good. But let's also not forget that many patients today are frustrated with a constant change, with constant changes in the healthcare system and the challenges they face in accessing care. This frustration and disappointment can sometimes lead to mistrust, in our ability to help them, or can cause them to doubt our intentions to help. But do I let them verbally abuse me? No. Do I respond to them violently when they're violent against me? No, because I have seen firsthand how our compassionate response and genuine care can make a whole world of difference. When patients feel supported and heard, they become more open to our suggestions and recommendations, and I hope to make them feel happy and contented with our recommendations. That is why it's important to remind them of our clear intentions, that we are here to help them, but we are also bound by the rules and expectations of healthcare, including the limited amount of time we have per patient. So it's a delicate balance, but by approaching each patient with empathy and understanding, we can make a positive impact on their healthcare journey. So, the more you practice approaching your patients with love and compassion, the easier it becomes to handle them with ease, no matter how difficult they may be. And always remember, as long as you've done your best for that patient or for your patients, there's nothing to worry about. So take the time to truly understand what your patients are going through, even if it means going a little bit over time. Remember, every encounter with a difficult patient is an opportunity for growth, patience, and becoming a better healer. I am reminded of something that motivational speaker Tim Story said. He said that when we are good to others, we are best to ourselves. And similarly, Jim Rohn also said, always, always wish for you to become better instead of wishing for things to be easier. So let's continue to grow and learn how to handle our patients, no matter how difficult we perceive them to be, with love and compassion. Remember, being good to others not only benefits them, but also helps us to recognize our own strength, our own worth, our own beauty, inside and out. I hope you found this video inspiring. And remember, I am your mentor and your friend. If you haven't done so, please subscribe. And if you need help with handling a difficult patient, or handling some challenging patients, leave it in the comment section and I'll do my best to help you. Bye for now.